Colorectal surgery, you have to have a little bit of a sense of humor. We deal with a lot of sensitive topics, so I always try to keep things light and fun, and as much as we can make it fun and make experience as comfortable as it can be in the office. Colon and rectal surgeons treat conditions that are cancerous and non-cancerous. We treat issues in the belly like diverticulitis. I love treating diverticulitis, as well as colon cancer, rectal cancer, anal cancer, inflammatory bowel disease like ulcerative colitis and Crohn's disease. We also treat issues that are anorectal. And finally, other than doing abdominal and perianal surgeries, we also do what's called lower endoscopy. So that would include colonoscopy and sigmoidoscopy. I think research is really important to the advancement of clinical medicine and our specialty. My involvement in research in the last several years has been primarily on the clinical side, patient-facing. I've also really enjoyed doing research projects with dozens of trainees, fellows, residents, medical students, the next generation. And these have mainly focused around clinical outcomes, surgical outcomes, quality of care, patient experience, and so on. I love the combination of research and taking care of people and clinical care. And as I went through medical school, I realized that I was good with my hands, that I really liked the immediate cure that surgery provided, but we also work on an area of the body that nobody wants to talk about, the what we call the perineal area or the anal area. And I felt that my personality would be particularly suited to making patients feel comfortable talking to me about their issues in that area. And people have come in and told me, I haven't told anybody that I have this issue for 40 years. And I've been really grateful that they've put their trust in me to tell me about those things. But that's why I went into this medicine, and then particularly into this specialty, because I think it needed more listeners. As a patient, when I come into a doctor's office, particularly for surgery, I want to feel heard. I want to feel like the doctor cares about me and has done their homework and knows what they're talking about. I think people do best in surgery if they feel prepared. They feel like they have decided that this is what they want to do after a discussion and informed consent with their doctor, and that they feel confident about it and that things are going to turn out as well as they possibly can. I'm really excited to be part of a team that can provide Johns Hopkins quality care. So we cover Northern Virginia, DC, and parts of Maryland, and patients can get their excellent colon and rectal surgical needs met. So I actually grew up in the DC area, DC, Virginia area, and I have family here right next to Sibley Hospital, and they get their care at Sibley Hospital. They've always told me how amazing their care has been. They've had medical and surgical care there. And I'm a mom of 3 kids, and as they're growing up, I thought I wanted to come closer to home, closer to the family. I was so excited to be part of such an amazing institution that is always at the forefront of research and clinical care.